Welcome to an insightful exploration of Bell's palsy, a neurological condition affecting the facial nerve. In this video, we'll delve into the causes, symptoms, diagnosis, and treatment options available for this condition, helping you understand the complexities of Bell's palsy. The exact cause of Bell's palsy remains elusive in many cases, making it an idiopathic condition. However, several factors are believed to contribute. Viral infections, particularly herpes simplex virus (SV), which causes cold sores and genital herpes, and herpes zoster virus (HZV), responsible for chickenpox and shingles, are strongly implicated. Other potential culprits include inflammatory conditions, autoimmune disorders, and, rarely, tumors that compress the facial nerve. Pregnancy, especially during the third trimester, and diabetes are also considered risk factors. Bell's palsy arises from inflammation and swelling of the facial nerve, the seventh cranial nerve, as it passes through a narrow bony canal in the skull called the fallopian canal. This swelling restricts blood flow to the nerve, leading to nerve damage and impaired function. The facial nerve controls muscles responsible for facial expressions, tear and saliva production, and taste sensation in the front of the tongue. When this nerve is compromised, it results in weakness or paralysis of the muscles on one side of the face. Bell's palsy affects individuals of all ages and ethnicities, occurring in approximately 15 to 40 people per 100,000 annually. Its incidence is slightly higher in pregnant women, people with diabetes, and those with upper respiratory infections. Both men and women are equally susceptible. While it can occur at any age, it is most common between the ages of 15 and 45. The hallmark symptom of Bell's palsy is sudden weakness or paralysis on one side of the face. This can manifest as difficulty closing the eye, drooping of the mouth, and impaired ability to smile, frown, or raise the eyebrow. Other common symptoms include drooling, altered taste sensation, increased sensitivity to sound on the affected side, pain behind the ear, and changes in tear and saliva production, leading to either excessive tearing or dry eye. In some cases, individuals may experience headache or dizziness. Diagnosis of Bell's palsy typically involves a thorough neurological examination to assess facial nerve function. The doctor will evaluate your ability to move facial muscles and test your sense of taste. Since the symptoms can resemble those of other conditions, such as stroke, Lyme disease, and tumors, it's crucial to rule out these possibilities. An MRI or CT scan of the brain may be performed if there are atypical symptoms or concerns about other underlying causes. In some instances, nerve conduction studies or electromyography (EMG) may be used to assess the extent of nerve damage. While Bell's palsy doesn't have distinct types in the traditional sense, it can vary in severity from mild weakness to complete paralysis. Sometimes it is classified as complete or incomplete palsy, referring to the degree of facial paralysis. Some cases may also be recurrent, meaning the condition returns after initial recovery, although this is rare. The primary goals of Bell's palsy treatment are to reduce inflammation and protect the affected eye. Corticosteroids, such as prednisone, are often prescribed to reduce nerve swelling and improve the chances of a full recovery. Antiviral medications, like acyclovir or valacyclovir, may be used in conjunction with steroids, especially if a viral infection is suspected. Eye care is essential to prevent corneal damage, so artificial tears, lubricating ointments, and eye patches are often recommended. Physical therapy can help maintain muscle tone and prevent permanent contractures during the recovery period. In rare cases where nerve damage is severe and persistent, surgical options may be considered, such as nerve decompression or reconstructive surgery. Unfortunately, there is no proven way to definitively prevent Bell's palsy, primarily because the exact cause is often unknown. However, maintaining a healthy immune system through proper nutrition, regular exercise, and stress management may help reduce the risk of viral infections, which are thought to be a contributing factor. If you have diabetes, managing your blood sugar levels effectively is crucial. The prognosis for Bell's palsy is generally good, with most people experiencing significant improvement within a few weeks and full recovery within a few months. However, the extent of recovery can vary. About 70% to 80% of individuals recover completely. Some may have residual weakness or involuntary movements of facial muscles, known as synkinesis. Rarely, some individuals experience permanent facial paralysis. Recent research is focusing on identifying biomarkers that can predict the severity and outcome of Bell's palsy, allowing for more targeted and personalized treatment approaches. Additionally, studies are exploring the potential benefits of early intervention with antiviral medications and the use of novel therapeutic agents to promote nerve regeneration. Thank you for watching, and we hope you now understand Bell's palsy better.